Thank you very much, Chair.
Good evening, everybody. Can I remind you, please, to keep your microphones off when you're not speaking, and if at all possible, to use your e-hands if you want to speak, not least because it's actually easier for me with my disability. I would like to advise you first that I'm going to reorder the agenda, mainly to bring item 8 forward, as the officer has to leave for another meeting shortly. And I do want time for her to be able to answer any questions you might have. And secondly, particularly for members of the public who might be tuning in, you will have expected Lakeside GP practice from Stamford to be with us this evening. They did contact us and say that they are having a re-inspection this week, and could they delay coming till March? And I thought, under the circumstances, they would have quite enough to deal with in terms of their re-inspection. So I have agreed. So they are coming, but not until our March meeting. So moving on then, Jane, do we have any apologies, please?
Yes, Chair. Apologies have been received from Councillor Boole, Mark Powell and Fiona Myers.
Thank you very much. I'm going to move on to item 3. Are there any declarations of interest? Dr. Underwood.
Yes, for the item of the health and wellbeing strategy and the place-led plan, as Chair of Health Watch Rutland, I do sit on the Health and Wellbeing Board. And for the item on the GP surgery, I am a registered patient at Oakham Medical Practice.
Thank you. Any other declarations of interest? Councillor Cross, are you waving at me? You're on mute.
Yeah, I also am a patient at Oakham Medical Practice, and my wife attends there as well, and my daughter also will be involved in the maternity job shortly.
Congratulations to her.
Well, thank you very much. Obviously, I had nothing to do with it. Thank you.
Councillor Powell.
Sorry, is it necessary to declare that we're registered with Oakham Medical Practice? Can we just have clarity whether that counts as a declaration of interest? Thank you.
As the law currently stands, it's up to the individual councillor to decide whether it is an interest or not. Personally, I wouldn't have thought it was on the same basis that we can all vote on the budget, even though we're council taxpayers. So we are all registered somewhere within Rutland, I guess. But it's, as I say, legally, it's entirely down to the individual to choose whether to declare or not. Okay, thank you. Moving on then, I will now move on to item 8, which I understand Viv is actually introducing. Enhanced Public Health. Over to you, Viv.
Thank you very much, Councillor Waller. Yeah, thank you very much for having me today. Yeah, just wanted to update the panel on the committee in terms of where we're at in terms of our evolving public health offer. So the paper that we've attached today has just sort of summarising, I suppose, how work between Rutland County Council and the public health team in Leicestershire County Council has evolved to really try and strengthen the public health role through Rutland. And we're really keen to look at that as in Rutland as a place, but also Rutland as a county council. So the paper just sort of sets out the refreshed approach around that. And what we're looking at now is almost having a mini public health team for Rutland, which means that you've got much more capacity from a public health point of view to really support driving that agenda forward. So the team now involves, some 0.2 whole-time equivalent of Mike Sands, the Director of Public Health. You have 0.4 whole-time equivalent, which is sort of 2 days worth of my time as a consultant in public health. to really lead the strategic agenda around public health for Rutland. And then we have 2 strategic lead posts for Rutland. So one is arranged around commissioning, and one is much more looking at policy work within Rutland as a place and as a local authority. We've also got some analyst support to support that, and I think that's a really important function. And they're all looking at things sort of like the JSNA and the so the Joint Strategic Needs Assessments and the Pharmaceutical Needs Assessments. And then what's been really fantastic as well is we've got Sandra, who you can see on the call, has joined the team as the Health and Wellbeing Integration Lead, which is really, really fantastic that we've got you know, employees from within Rutland County Council within our mini public health team as well. So we're really pleased, and she's making a fantastic addition to the team. So thank you for that. But in terms of what we can offer and what public health is, so the definition of public health is the science and art of promoting and protecting health and well-being, preventing ill health and prolonging life through organised efforts of society. And I suppose really the importance I want to just bring out here is that public health is a science in terms of we can bring a lot of technical skills and a lot of data analytical side, but it's also an art in terms of that leadership and that system leadership role that we do bring. Our overall outcomes are improving healthy life expectancy and reducing health inequalities. And there's a range of ways that we can do that in terms of the leader, partner and advocate roles. So whether that's leading through specific commissioning, through the public health grant, being a partner from the wider ICS system, or advocating and working with our local communities to support them to make healthy choices. And in Appendix 1, you've got the 4 different domains of public health. So that sort of shows you the breadth of work that we can support on. So that might be things ranging from looking at the wider determinants of health and acknowledging the impact of you know, education, employment, housing, our climate, our social community around us, that the impacts that those can have on our health, to some of the more traditional things around maybe health improvement, health protection. Obviously there's been a lot of work around that with the COVID pandemic at the moment, and also healthcare, public health, so how we can work with our healthcare colleagues and primary care networks to support and improving access and quality of healthcare services. So I'll leave it there, and I won't go into too much detail, and just open it out for questions really. Appendix 1 shows you a few examples of things that we are either involved in currently or are things that we could be involved in moving forward. And a very big focus of the work at the moment has been developing that joint health and wellbeing strategy and delivery plan, and I won't go into that because I've got that later on in the agenda. But just really open to comment and any questions from the committee on that. So thank you very much.
Thank you very much, Viv. Members of the panel first, do you have any questions or comments? Councillor Powell, please.
Thank you, Chair. Thank you for the report. I did put in a question in advance, which is listed and your answer. If I may, I'd like to dig a little deeper in that, because I didn't really feel that my question was fully answered. I can see in the report you stated what percentage points of people we've got. The context of that wasn't clear. So how much extra have we got, to what level? There was no comparison to what we've got now. So how much extra does that give us? And also you're asking for recommendations from this scrutiny panel for priority public health areas to focus on over the next year. And again, I wasn't clear. We've got those 4 domain areas. What level are you asking the scrutiny panel to comment on which of those should be priority? Where are we looking? I don't know how much time we've got, what level of person we've got actually looking at that. So that was a very wide question. I think without necessarily the guidance, if you're wanting those recommendations, I didn't really find it specific enough to be able to give full consideration, to give a considered recommendation from this panel. So it's 2 things really: the context and actually what precisely are you looking for in terms of recommendations. Thank you.
Viv, would you like to come back on that?
Yes, please, thank you, and thank you for the question, and apologies if it wasn't clear enough in the paper. So in terms of what you're getting extra, the additional post that you're getting is the dedicated consultant lead. So so that 2 days a week of consultant capacity, which is my capacity, is new. So it's not that you didn't have a consultant lead before, but it was more in the wider 4.91% offer that Leicestershire County Council pays, whereas now you've got much more dedicated consultant time on that. And the extra post is the additional strategic lead post. So whereas before you had one strategic lead, you've now doubled your capacity in terms of that strategic lead, and that's really useful capacity to really do some dedicated work around understanding the needs, understanding the issues, and really providing that technical support around public health for you. So they're the additional strengthening that you've got there. So I really would say that's really bulked up. The additional thing as well is the reallocation of Sandra Taylor's role around that health and care integration, and she's doing a tremendous amount of work around the joint health and wellbeing strategy and that health and care wider agenda, but also the work of the Health and Wellbeing Board. So Councillor Harvey's on the call today, and there will be much more work around how we can evolve that board to really make it the place board for Rutland around health and care. So that's sort of the additional capacity. In terms of priorities, obviously we've done a lot of work around priority setting around the joint health and wellbeing strategy, and that's where we've dedicated our time. And I suppose what we're looking for there is, are there any of that feedback that you're getting from your local population that you feel that we're not picking up through the priorities of that area? And are there any gaps that you think that we've put in the paper that you think are glaringly obvious that we've missed, really? So I think hopefully we will have covered a lot of that from the joint health and wellbeing strategy and the delivery plan, and we can come on to that later on. But if there are things that you are getting a lot of feedback from your constituents that you feel that we're not feeding back on, then we're really open ears to understand that and try and unpick that a little bit more to support that agenda.
Any other questions from anyone? Councillor Cross. Can you unmute yourself, please?
I'm not used to being so quiet. Vivian, thank you very much indeed. Your strategic leads, will they be innovative as well as our existing Department for Health and Care under John Morley is innovative and has been for so many years? Thank you.
Do you want?
That was a question.
Are you wanting to answer that question, Councillor Harvey? Then please do.
Yes, please, Chair. I was going to confirm to Councillor Cross that indeed there is great innovation coming in from both Viv and Sandra, and it can be certainly seen in the health and wellbeing strategy come forward. There is a really wonderful team between John, Vivian and Sandra that work really well together, and it is really reaping benefits. So I can confirm that indeed there is a really dynamic team there that is thinking of all our issues, which we know it's a complicated jigsaw, and they are working really hard together to try and sort out that jigsaw.
Anybody else have any questions? Right, well, I have a comment, and my comment is we have a fair bit of what, but not a lot of why. And I would like to see more why. I'd like to see far more understanding of why our residents are or are not behaving in the ways that they are. Why are they not having healthy lifestyles? There won't be a blanket answer. Different groups will respond in different ways, clearly. But some people choose not to have a healthy lifestyle. Others have no choice because of lack of access to whatever it is would make their lifestyle healthier, good food perhaps. And I think we need to get underneath why is our residents behaving or not behaving as they do. And in terms of feedback, I mean, it's not necessarily a public health issue, it's a health issue more widely. A lot of the feedback I get is around we can't get an appointment with our GP, we can't get an NHS dentist. Our children can't get an NHS dentist. And I can't use the app that you need to use to make appointments, etc., etc. I mean, you will have heard it all before. There's nothing we can do to improve the general public health if we can't address all these barriers. And they are very real barriers. And I don't know about my colleague councillors, but I'm starting to get emails now from Rutland residents who are not in my ward, but they've seen my name next to words that include health, and they think I can solve all the issues. And I might be marvellous, but I certainly can't solve all these health issues. But I actually think it's important that we understand far better than we appear to do what the barriers are. So that would be my comment for you to take away. And if anything, that might be a recommendation from me, although clearly it's not a formal recommendation because I haven't phrased it as such. Very briefly, Councillor Harvey, please. We've got a big agenda and I was using my chairman's prerogative to sum up at that point.
Oh, okay, sorry. It was comment. I was going to say that those 3 points that you did raise are in the draft health and wellbeing plan, and we are fully aware and are, as you say, it's very complicated, and those certainly those ones are ones that we are attempting to address within the plan. Thank you.
Thank you. Right, so no more on that. Thank you, Viv, for your presentation. Moving back now in the agenda to item 2, the minutes of the last meeting. First of all, can I have a proposer and a seconder to approve the minutes? Thank you. I saw Councillor Powell propose and Councillor Cross second. All in favour, please. I think that's unanimous. You weren't with us last time, were you, Councillor Ainsley? No, that's fine then. I know it's not on the agenda, but again, Chairman's prerogative. Can I go through the action points? Viv was going to provide me with some more data, which she did. And Jane, there were a couple of action points for you. Would you like to report on them?
Yeah, certainly, Chair, if you can remind me what they were.
Hold on a moment. I did underline them as well.
Let's have a look.
The first one was in respect of Lakeside. It was item number 8 on the agenda, and the second one was the putting the vice chair on this agenda, which you've clearly done.
Yes, and all actions completed.
Fine, that's wonderful. Thank you so much. Right, moving on then. I succeed always in getting these papers out of order. Here we are. 4, petitions, deputations and questions. I believe we have both a deputation and a question tonight. Is that correct, Jane?
We do, Chair. First of all, we have a deputation from Mr. Ramsay Ross, and I will just promote him through into the meeting.
Thank you very much.
Good evening, Mr. Ross.
Good evening. I hope you can hear me.
Yes, we can.
We can hear you. Could I remind you, you have 5 minutes to present your deputation. And could I also remind you, please, that you are to read it as you presented it, and members of the panel will have an opportunity to ask you questions on it.
Thank you. So, by way of context, a health plan for Rutland requires to incorporate 1, a needs assessment, 2, health outcomes with a strategy to achieve them, followed by 3, an implementation plan, a major step for Rutland and much welcomed. The issues. The Health and Wellbeing Board are to be congratulated on the work it has done and presented to date on this major project. The work is of a high quality, but still incomplete. And we ask that the following steps are taken before signing off any health plan for Rutland. Firstly, prepare an integrated summary to describe clearly to Rutland people and the ICS what the 3 discrete pieces of work aim to achieve, how they link together, and what services will be provided as the plan is implemented. The Department of Health wishes the NHS plan of 2019 to be the driver of future ICS plans. The adoption of this framework by the Health and Wellbeing Board would explain to residents that going forward, high-tech services will be provided in hospitals, whilst low-tech services will be located closer to home. Then address the following shortcomings in order to complete the plan. Health needs assessment. This has not been updated since 2018 and consequently ignores the important evidence presented by the Parliamentary Inquiry into Rural Health and Care. It was published in February 2022 and has established that deprivation in rural areas has been incorrectly measured nationally, leaving rural communities such as Rutland disadvantaged. We recommend that the needs assessment now be updated with specific attention to the issue of rural deprivation. Health and Wellbeing Strategy. This was updated after consultation, but omits several key issues raised by the public in section 3.3. The issues in 3.3 include A, the impact upon women of closing the LGH obstetrics and the St Mary's birthing unit. B, access issues such as the whole pathways, continuity of care and diagnostics. The Health and Wellbeing Board has included references in its agenda for 22nd February, but references do not of themselves amount to clear direction. Resolution of many University Hospitals Leicester mitigation issues were passed to the Health and Wellbeing Board in August 2021 and require to be fully addressed in any strategy document. In summary, these shortcomings are all critical issues for Rutland and should be actioned to demonstrate that Rutland Health and Wellbeing Board is implementing government policy as set out in the NHS Plan 2019. Lastly, implementation plan. The first draft in today's papers is an excellent compilation of the health and wellbeing issues facing Rutland. Unfortunately, it is incomplete as it fails to provide a detailed implementation plan in terms of the current position, defining where we want to get to, and the associated costings and metrics for such proposals. We recognise that there is significant work involved in providing such detail, but consider it essential if the proposals for Rutland are to be given a properly considered assessment by the ICS when settled alongside those submitted by Leicester and Leicestershire. It cannot be acceptable to residents that Rutland's case is presented as half a plan. In summary, we support the progress that Rutland Health and Wellbeing Board has made and hope members of Scrutiny will encourage the Health and Wellbeing Board to focus on addressing the issues highlighted in this paper. Thank you.
Thank you very much, Mr. Ross. Do I have any questions of Mr. Ross from members of the panel? Okay. Thank you very much for your deputation. Oh, sorry.
Sorry, Chair.
Councillor Cross.
You're on mute,
microphone.
Councillor Cross.
Right, not a question, but I'd just like to thank Mr. Ramsey for that very, very good deputation there. It's most interesting and very, very important. Thank you.
Thank you. We have the portfolio holder for adult and health here tonight, and I'm sure she will draw the Health and Wellbeing Board's attention to the points that you make, Mr. Ross. But as there are no further questions, I'd like to thank you for your deputation and the time you put into writing it and coming to us. Thank you.
Thank you.
And question, can you promote Mr. Nebel, please, Jane?
Yes, we have received one question from Mr. Nebel, and I will just promote him through.
Good evening, Mr. Nebel. Can you hear me?
I can, and thank you very much for allowing me to pose a question to the committee. Thank you, Chair.
Unlike the deputation, you only have 1 minute for your question, so I'm sure it won't take you that long to ask it. And I will respond to it. There won't be an opportunity for members to ask any questions. That's our process. Mr. Nebel, please.
Thank you, Chair. Does the committee believe every opportunity to maximise close to home delivery of hospital and diagnostic services within Rutland is being considered by Leicester, Leicestershire and Rutland CCG and pursued by Rutland County Council within its place-based health plan, with particular reference to ensuring that significant investment in Oakham's Rutland Memorial Hospital occurs to ensure it can serve the county's needs and avoid Rutland residents having to travel to Leicester for treatment?
Thank you very much, Mr. Nebel. We, as a scrutiny committee, have yet to fully scrutinise the local plans for health, and indeed, you will have seen that item 10 on the agenda does in fact cover our health and wellbeing strategy, and I'm sure as a committee we will come to a view, or more of a view, when we've had that debate at item 10. So I'm not sure we can give you the assurances at this stage that you are looking for. Be assured, though, that Rutland Memorial Hospital itself has been of interest to this committee for almost as many years as I have been a councillor, and is not something that we will forget easily. I don't know whether that's any help, but I think that's all I am able to say at this moment in time. Thank you. Moving on, we have no other deputations, petitions or questions, do we, Jane?
None others received, Chair.
Thank you. Can I move then to item 5? Do we have any questions with no notice from members?
None received, Chair.
Thank you. Or notice of motions from members?
None received, Chair.
And has there been a call-in?
No call-in received, Chair.
Right. I would like to move on to item 9 on the agenda. We have a vacancy for Vice Chair. It was a role I previously filled, but when Councillor Harvey was promoted to the Cabinet and I was promoted to Chairman, we then were left with vacancy. So does anybody wish to make a nomination for Vice Chair of this committee? Mr. Cross.
Thank you, Madam Chairman. I'd like to propose that Councillor Rosemary Powell takes on the job of Vice Chairmanship.
Thank you very much. And do I have a seconder, please? Thank you, Councillor Tozand. Any other nominations? In which case, I declare Councillor Powell as Vice Chair. Thank you, everybody. And I'm assuming you're prepared, Councillor Powell, to accept?
Yes, thank you. Yes, happy to do that.
Thank you very much. Jolly good. Right, moving on to item 10, the Rutland Health and Wellbeing Strategy. I understand that the portfolio holder, Councillor Harvey, is going to introduce this item. So over to you, Sam.
Thank you very much, Chair. I don't intend to take too long in my introduction, as I'd like to hear members debate. The background to the strategy is detailed, and I'd also like to highlight the results of the consultation. I would like to thank all those that took the time to participate and shape the plan. From this, the delivery plan is detailed from 5.1 in our report. As stated, the plan is a technical document, and we do fully intend to have a more plain language document to be published so that it can be understood by all. 5.4 highlights the major developments that have taken place from December. The delivery plan, as set out, is now in 7 sections, and it's worth noting that where possible, it does link in with existing and emerging work streams and initiatives. So those such as the first 1001 days in early years. In order for the Health and Wellbeing Board to monitor the work, once the board has agreed the plan, then a matrix will be incorporated so that the board can monitor the progress. Think RAG ratings. Viv and I get quite excited about those. A regularly produced data dashboard will also allow changes in key indicators to be tracked along. And the delivery plan will go on to become a place-based plan under the integrated care system that is due to go live in July. As such, in some ways, it's still a developing work programme with some unknowns. These are multi-agency plans and will also evolve as partners collaborate in a combined way towards our shared goals. Added to that, we do have the reconfiguration programme for Leicester hospitals, and as plans for that are formalised and developed, they will feed into and change parts of this plan, we're sure. As such, it's imperative that what you see today is a dynamic living plan that can accommodate this from the start. So that's my very short introduction. I will open it out and answer any questions, and I'm pleased to welcome both John, Sandra, Viv, and I think Baylis is also available to answer questions. Thank you.
Thank you very much, Councillor Harvey. Questions from members of the panel, please. Or observations, of course. Councillor Toseland.
Sorry, Councillor Cross, I noticed his hand was raised before me. Is that...
No. Ladies first. No.
I have comments rather than questions, in that I'm concerned that there is a lack of attention when addressing cross-border issues, especially in terms of displacement when we have following the closure of the Leicester General, or exploring the possibility of developing local solutions. And I don't mean just in Oakham. I mean, I'm sorry, I've got a really bad echo and that's affecting how I'm speaking, but I also mean for others close by, such as Melton and Stamford. And we have a plan, although I do feel there is a lack on the specification on how to measure the objectives. And I want to ensure that Rutland's voice is heard throughout the decision-making process. I wonder if there may be a need for a non-executive director representation within the ICS in the future. Thank you.
Thank you. I think that was a very interesting comment. I don't know whether Councillor Harvey wants to come back on that, particularly the last point about representations to the ICS to get a Rutland non-exec.
I will come back on some of it, and I will. I think hopefully is Baylis. I can't see her on my screen. Has she dropped out of the call? Hopefully John might come in on the technical non-exec part. So the integrated care system that's coming in July will obviously have a system level. Our place-based plan is below that at local authority level. On the system level, and I think, Faye is here, thank you. She'll be able to come in and explain in technical details. There is both the integrated care board, which does have representatives from Rutland on, and we also have different representations. I'll let Faye come in if that's all right and just explain the technicalities around it. It's not, to my knowledge, it's not completely formalised yet.
Thank you, and I apologise. I did drop out of the meeting temporarily. My connection's very poor at the moment, I'm afraid. So would you mind repeating the question, because I didn't catch all of it?
Councillor Turson, please.
Thank you. Sorry, I'm also having problems with an echo on my end, so I'm going to try turning my camera off to see if that helps while I speak, if that's okay. I think my main question was whether there may be a need for a non-executive director representation within the ICS to ensure that Rutland's voice is heard. I'm quite concerned about the amount of attention paid to exploring and addressing the cross-border issues, especially in terms of displacement following the proposed closure of Leicester General, or exploring the possibility of developing local solutions, not just in Oakham, but others close by, such as Melton or Stamford. And I was also wanting to see more specification on how we measure objectives within the plan.
Okay, well, I'll attempt to answer the question around non-executive directors. So I can confirm that 4 non-executive directors have been appointed to the ICS under the chairmanship of David Sisling. I'm not sure if those names are now in the public domain, but certainly there are non-executives within the ICS. In terms of cross-border issues, I would say that we have acknowledged the fact that we need to address some of those issues. And in the plan itself, it does talk about the fact that the neighbourhoods, even though Rutland is a neighbourhood in its own right and a place, actually we do need those flexible boundaries, because people and the way they live their lives don't observe those strict border issues. So we have been engaging with our partner systems, and some of that I believe is detailed in the plan and indeed the delivery plan. But I'll defer to Viv, who I can see has got her hand up, who may be able to add to that.
Before I bring Viv in, when you say there are non-executive directors appointed, I think we were all aware of that. The question is, are there any Rutland non-executive directors?
I'm afraid I don't have that level of detail.
Viv, would you like to come in?
Thank you, Chair. Just in terms of some of the wider ICS stuff, I'm quite happy to provide a little bit more context from the work that I'm doing, if that's helpful. So there's quite a lot of work evolving at ICS level at the moment, currently looking at the roles and function of the Integrated Care Board and the roles of the Integrated Care Partnership. Now, as has been previously mentioned by Councillor Harvey, there will be Rutland representation on both of those boards. So it's from the Integrated Care Board, which it will almost be like the NHS governing body as the moment. There will be at least one representation from Rutland. Now, it may not be a non-executive director, but it will be a member of Rutland County Council in one way, shape or form. So you will get that reassurance from the Integrated Care Board. And then from the Integrated Care Partnership, the membership of that group is just evolving at the moment, but there will be significant representation from Rutland there in terms of lead member, but also a range of directors from Rutland there. So please do be assured that there will be a very strong Rutland voice in both of those areas of the ICS. In terms of the question around specification to measures, we have tried as much as we can to put in some initial matrix that we are using, and you will have seen in some of the performance reports that we're proposing, that there are specifics that we're looking at in terms of if it's, I don't know, we're looking at tooth decay in under 5s, for example. There's a specific public health outcomes matrix that we can use to do that. What we haven't got to yet is saying that we want to move from, let's say, X to Y. And the reason why we've not got to that level of detail is because we really want to make sure that we're doing that in a collaborative way with partners, so that partners are buying into those key performance indicators and SMART objectives and owning those collectively, and also making sure that they're realistic and achievable. So I do think some of that detail will come. Hopefully you will see the progress that's been made since we came in December, and this delivery plan will continue to evolve. So please do bear with us that if we haven't got quite as much of the specifics that you want at the moment, that we are looking at how we constantly develop that. And I do think the dashboards that we've put at the moment, they are proposals, but we hope to build and evolve on those as the 5-year strategy does over the time period. So hopefully that gives you just a little bit of reassurance there.
Thank you. I think John wants to make some comments on this point as well.
Thank you, Chair. Excuse me. Just add some further assurance to Councillor Toseland about Rutland representation is clearly something that we take very seriously as an authority, because we are place as well as neighbourhood, and therefore we must take a great deal of responsibility around here. And that cross-border issue is an important one to us, and it's something that we've been reiterating time and time again. It's been prevalent in society for time immemorial. We now have opportunity to actually start to crack down on this one. And for Rutland in particular, I think it is quite important. There is the ICB, as Viv said, and underneath that is what's called the clinical exec. And on that is, the system executive, where Mark Andrews represents us. At the integrated partnership board, I and Councillor Harvey, I and Councillor Harvey both sit. And underneath that now, we have what's called the Rutland Strategic Health Development Project Board, quite a mouthful, that I and Penny Sharp sit on, and we are specifically addressing the cross-border question on that. So please rest assured, these are very important to us as officers and practitioners and clinicians, as indeed they are to the public, because we wouldn't be doing our jobs if we didn't represent Rutland in that way.
Thank you. And I'm terribly sorry, I don't know who put their hand up next, whether it was Councillor Powell or Councillor Cross. One of you speak up, please.
I think it was Councillor Cross. Do you want to go first, Councillor Cross?
You're on mute, Councillor Cross.
I know, ladies first.
Councillor Powell then, please.
Thank you. Yes, obviously I can see there's a lot of well done for a lot of detailed work going into the development of this plan since we last looked at it. My question, which again I did put in advance and I'm still a bit struggling with, is outcomes. Now I know Vivian talked about the metrics and measurement, which is fine, and I appreciate some of those details still need to be filled in, but having a plan, we need to know first of all what outcomes, what we want to achieve before we can sort out the activities. Now I noticed that there is an outcomes report going to the Health and Wellbeing Board next week, which I also noticed was only for 3 years. As I understand it now, this strategy has been changed for 5 years. So my question was, well, I'd have thought that that was a key part of these papers that should have come to this scrutiny committee, and that those outcomes should be established first, maybe not all the details, and then the activities to achieve them feed into it. So I feel there's a lot of good stuff in here, but I'm not sure, I'm not totally clear how it all fits together to really focus on the key things that we want to achieve. And why that outcomes paper isn't included in our papers. Thank you.
Viv.
Thank you, Councillor Brown. Thank you, Chair. So the honest answer is it was in terms of timescales, and it was in terms of the fact that the timescales for the scrutiny papers are ahead of the timescales for the Health and Wellbeing Board papers. So it was purely a case of the fact that the papers weren't available by the time we needed to get them published for this meeting. So my sincere apologies around that. We wanted to give as much as we could. But as you can tell, a lot of work's gone into the plan, and a lot of collaborative work has gone into the plan, which is why it's taken a little bit longer to get to it. So we can absolutely make sure that Scrutiny is sent that report and that it is published as part of the minutes if that's helpful. That dashboard is what I was talking about in terms of how we're going to evolve performance monitoring the board, and that will become a regular item for the Health and Wellbeing Board moving forward. So we've got really clear awareness of where we're making those outcomes from a quantitative or a data point of view, but then we are also looking at ways to evolve the Health and Wellbeing Board and our conversations with our local community to make sure that we're getting that really rich data from interviews and focus groups and surveys and things like that as well. So I think apologies that you didn't get the data in time. Those outcomes are very much aligned with the high level outcomes with the priorities that are in there, and those outcomes are also reflected with those that are in the delivery plan as well. So they're sort of the high level outcomes of that.
Thank you. I would like to remind officers that Scrutiny has a role to play, and to think about that when you're planning your timetables. And so it would have been helpful, knowing that this was going to be an agenda item prior to the Health and Wellbeing Board, and you did know this back before Christmas, that you planned accordingly. And I appreciate that that might be seen rather as a rap across the knuckles, but actually I do feel very strongly about Scrutiny not being sidelined because of timetable issues. Rosemary, would you like to come back on it?
Yes, I accept the pressures on the timescales, but to me, the most important thing about this health and wellbeing strategy is the outcomes. That what are we hoping to achieve? We can do all the activity in the world, but actually, if it's not focused on achieving the outcome, then everyone is not wasting their time. So to me, that was the most important paper that I would have liked to see at this scrutiny meeting, and backed up by the activities that were going to achieve it, not the other way around. And I think that's one of the points that was actually raised by Mr. Ramsey in his comments on the implementation plan, which I would fully endorse. Thank you.
Thank you very much. And I think you're absolutely right, Councillor Powell. And there isn't any point in doing activity if you don't know why you're doing it and whether you've chosen the right one to achieve what it is you're intending to achieve. Are there any other points from members of the panel? Councillor Cross, I will come to you, Dr. Underwood, when I've heard from all the panel members. Councillor Cross.
Right, thank you, Madam Chair. This is under building better hospitals. And I'll keep banging the drum. Rutland Memorial Hospital, our cottage hospitals are indispensable with the amount of money that's going to be put into the new hospitals in Leicester. For them to run efficiently, they have to get the patients out as soon as possible. And I think we cannot bang the drum more than tell them that without the cottage hospitals, they will have nowhere else to send a lot of these patients. So when we get achieving the outcome, which was just mentioned, I think we've got to put things in place so that we can achieve the outcome that our NHS wishes to achieve. Thank you.
Thank you. Councillor Powell.
So just one, can I just ask the question about the health needs assessment and whether that will be updated? Thank you.
Viv?
Thank you, Chair. So just to reassure the panel, and apologies if you're getting feedback from my earphones, there has been a needs assessment that was done in terms of the work to get to the strategy to where it was. So please, just to reassure you that there is a needs assessment work that was done that, and it was looking very much around the published public data that's available at the moment. If you're talking more closely about the joint strategic needs assessment work to update that, we're looking at when we plan that, and basically the census data should be out within the next few months. So because of that, we've decided that, and that will give us data that will be updated from a 10-year point of view. So the 2021 data, which is a really, really rich data source. So the decision has been made that we will wait until that data is released. And I would hope that over sort of early spring time that we could at least get the demographics done. And it will be one of those things that it will be drip fed over a few months in terms of as they release the new census data. Hopefully that will give us a much more richer and much more up-to-date picture of where Rutland is. So that will happen over the next few months. And then as part of that, there are a range of joint strategic needs assessment chapters that will do a bit more digging into some of the issues that are really important to Rutland. And some of these are mentioned in the delivery plan. So we've had discussion around doing a specific chapter around the military and veteran population and understanding that. Doing a particular chapter around really understanding the health inequalities across Rutland and what we need to do with that, and particularly looking at that around the access issues. So I know we had quite a lot of discussion today around the border issues. We really want to unpick that so we are absolutely clear on what they are and how they look and how they feel, and then so that we have really clear actions moving forward around those. And the other area that we've got already on the in the delivery plan is around dying well and really understanding what really good end of life looks like. So what services we've got now and what services we would like in the future. So that's sort of our forward plan on that, and more detail will come in sort of the coming months around that.
Thank you, Viv. Rosemary, did you want to come back on that? Okay, thank you. Councillor Harvey, you want to comment on the same point, I gather?
Yes, please. Apologies, I've had to, my internet went down completely. So I hope you can hear me. I'm kind of banding off my phone, so excuse the picture, I'm afraid. It's as good as we're going to get at the moment. Yeah, I was just going to reiterate what Viv said. The JSNA is a separate piece of work that the Health and Wellbeing Board will pick up separate from this strategy. It will feed into this strategy, but that in itself is a standalone piece of work. And as members are probably aware, quite a few of the chapters of our current JSNA are out of date, and it will all need updating in a post-COVID world as well. Obviously, as a lot of the chapters were due to update during COVID, and so that is one reason why a lot of them are out of date. And then we've had lots of new legislation as well, such as the domestic violence bill and all of that. So all of that new legislation, the Armed Forces Covenant bill, all of that brings in new things across which will change it. So it will all be updated in the next calendar year. Thank you, Chair.
Thank you very much for that, Councillor Harvey. Any other members of the panel? In which case, the floor is yours, Dr. Underwood.
Thank you, Chair. It's really a comment to just reassure councillors. Health Watch Rutland and Health Watch Leicester and Leicestershire, the two of us chairs, we have regular meetings with Andy Williams, the Chief Executive of the CCG and Chief Executive-elect for the Integrated Care System. We had a meeting this morning and he has confirmed that both Health Watch chairs will have a non-voting seat on the Integrated Care Board and also a seat on the what he now calls the Health and Wellbeing Partnership, but which we know as the Integrated Care Partnership. And we very, very much try to bring to his attention at these meetings and on the boards that we attend the needs of our local population. And in my case, obviously it's Rutland. So I hope that adds a little bit more assurance about our representation at the system level.
Thank you. If there's nobody else, I will do my summing up of my comments. Very specific, where you refer to sponsor in the activities, you've got a do, sponsor, watch approach. So the sponsor in that, I do think reporting on an annual basis is too infrequently. I would have thought twice a year would have been much more sensible. having looked at what it is you have a sponsor for. That's my general my specific observation. And my more general observation is that I did feel, I thought the feedback you got from residents was very helpful, very good. But I do feel that you haven't really got under the skin of what Rutland is like. And I appreciate what Viv was saying about doing more work. But take the veterans, for example. I suspect if you do the work, you will discover that veterans who are older and therefore were here as RAF, their needs will be different from those who are younger, who are here because they have been army personnel. And I think you need to get to that level of difference, which is why in the questions I have submitted, and people who are watching will see the questions that we submitted in advance and the answers we got as part of the minutes, why you will see that I was raising questions about special needs in the secondary sector. I don't think we can use things like special needs as a proxy. I think we need to get underneath what it all means. So that's my comment. I did say I was summarising on that, Councillor Harvey, and I want to keep to time. So I am going to move on to the next agenda item. And I am going to ask Councillor Ainsley to introduce item 11.
Thank you, Chair. The item is the Primary Care Task and Finish Group Preliminary Report. And this item presents the data gathered by the group, accompanied by a preliminary report and an outline of the methodology used. The group continues to strive to understand the residents' perspective with accessing primary care, and have at this preliminary stage, the group has deliberately chosen to present the patient survey responses exactly as written in a raw and undiluted form. When looking at information gathering, the patient engagement with the online questionnaire was good and provided valuable insight into patient experiences. The group continues to gather information, and with the exception of Market Somerby and Overton, have recently completed the consultation with the patient participation groups. Dr. Hilary Fox, Clinical Director, Rutland Health Primary Care Network, and Rachna Vyas, Executive Director of Integration and Transformation, Leicestershire and Rutland CCGs will both be attending the next group meeting this coming Monday, the 21st. Excuse me. We are very much looking forward to this consultation and have submitted a number of written questions, which are in addition to the questions already asked in the GP survey. A revised questionnaire has been submitted to the GP practices, and we are awaiting responses. Turning to the final report, we will be dissecting, interpreting the responses to the patient and surgery surveys, as well as our consultations with the patient petition groups, Rutland PCN and LRCCG. The final report, in addition to reporting the patient experiences, aims to make recommendations on the emerging primary care delivery models and long-term infrastructure planning. Thank you all very much. Are there any questions?
Indeed, are there any questions or comments?
Indeed.
Councillor Powell.
Thank you, Chair. I think this was a really comprehensive survey and brought out lots of interesting comments from residents, and obviously you had a very good response, so well done on that. It was just really a bit more specifics on the next step. I see you've got your sort of schedule, you say a report. Just if you could just expand a bit on who reports are going to, and when that will be helpful in terms of actually your and where recommendations will be made. Thank you.
Certainly. If I could refer you to the work plan, the report will be going obviously to the Adults and Health Scrutiny, who will be authorising the final report and making recommendations to us. It'll also be going to the Health and Wellbeing Board, and then on to full council. Superintendent.
Can I come in there? Can I ask the Task and Finish group and yourself, Councillor Ainsley as chair, to come up with a series of recommendations, or maybe only one recommendation? I mean, that's your choice. But if you're going to refer it to full council, to Health and Wellbeing Board, and indeed it's coming to us for sign off, that bit I understand. But if there are specific actions for any of those groups that they form part of a recommendation quite clearly set out, so recommendations for Health and Wellbeing Board, recommendation for Scrutiny Committee, and so on, so we all know, we all understand. Our recommendation may be further follow-up work, it may be to endorse and send on. It doesn't have to be a complex or complicated recommendation, but I think we would all find it quite helpful if we knew who we were expecting to do what. And while I'm speaking, I have to say I am impressed with the amount of work this Task and Finish group has done. And I am, having read through all the comments, for, the responses, I was shocked at the different feelings of the essentially 3 GP practices in Rutland. I don't know whether you were, but I certainly was. I expected a lot more conformity. But I hope that the officers who are putting our various strategies together do take account of the comments that came back to you through that survey. I don't expect you to comment on that. It's my comment to our officers, actually, because I think it's very valuable, a very valuable resource for the development of policies going forward. But do you want to respond to my first point about recommendations, Paul?
Absolutely. Thank you, Councillor Woolley. Yeah, absolutely. That's a very sensible idea. We'll do our very best to aim our recommendations at the particular groups that we're going to be addressing. And I do echo your point. It did come as a surprise, I think, to large members of the group that there wasn't, there were exemplars within the data that we had, and there are also others that performed less well. And I think it's come across that there was indeed a strength of feeling within Oakham that wasn't necessarily echoed within the other practices, but there's an awful lot to be learned from this, the patients themselves and their responses. And we were very keen to present the data as is. I think that's really important. Okay, thank you.
Yes, I think that was particularly helpful. Councillor Harvey, as the portfolio holder, do you have any comments on this one?
Sorry.
That's all right.
Well, my mouse is not going to do much to get me off mute, is it, on my iPad? Apologies. I know, like yourselves, really, I would thank the 900 odd residents who took the time to complete the survey. It is a comprehensive view from our residents currently. There is obviously lots of work for the Task and Finish group still to do, as this is just raw data. And no, it is. I really look forward to the kind of coming together of all the other information that I know the Task and Finish group are collating, and then us all working together with the practices to improve the experience for some of our residents, because obviously there are residents that aren't satisfied currently, and maybe we can look at some of our practices that are doing really well, and find out what they're doing slightly differently that can help us all work together to improve it, so that residents all over Rutland can get a service. But no, I think it's wonderful the 900 people took the time to respond to the survey. Thank you, Chair.
As do I, and thank you. Going against everything else I've done this evening, because I think we were at summing up point, I will bring Janet Underwood back in, because Health Watch Rutland is supposed to be the voice of the people, so I think any comment that she will be particularly pertinent. Please, Janet.
Thank you, Chair. I've got a few comments, actually, if you've got the time. The first one is a question, actually, is to ask Councillor Ainsley if demographic detail was taken from the participants in the survey, because that might throw an extra layer of information for the GP practices and everybody else concerned. My second comment is, no time is right and everything is changing in time, but I'm acutely aware that at about the time that this survey was launched, the government launched what they called the Winter Access Fund, which the GPs were able to access to improve the patient access to appointments. And I'm not sure whether that was taken into consideration, whether that has been beneficial in Rutland or how much uptake that has. So I think that's something that's probably quite important to get to the bottom of. And also on the timing factor is that I am aware that sort of in the middle of this, from your start to now, Oakham Medical Practice installed a cloud-based telephone system. I know they've had some teething problems with it, but I'm also not sure how much this has improved the situation for patients. We haven't really had a great deal of feedback. And I think that's probably something that's quite important, because access was really has been a difficult issue across the county, but specifically at Oakham Medical Practice. And then finally, I think there's a little bit of confusion of in the surveys, particularly on some of the terminology. For instance, the people that take patients' calls are variously described as call handlers, receptionists, or care navigators. I think that needs to just be considered when you're doing the final analysis as well, if you bear with me. Finally, we were quite shocked initially with the first draft that was released at the beginning of the week to see individual doctors being named. We see that's been redacted now, but can that be a policy going forward in this, that no individual doctor is named in any document you publish, please? Thank you.
Turn to your last point first, if I may. Yes, that it was an oversight. It certainly was never a policy to disclose doctors' names. So that has been corrected, and that will not hopefully happen in the future. We will certainly strive. What demographic detail? You asked a question about demographic detail. What did you have in mind?
We were thinking particularly age and gender. No. Because we feel this reflects very much on whether people prefer face-to-face or telephone. What we've found in the past is the younger population are much more au fait and much more ready to use technology for their consultations, whether it's online or telephone, whereas the older population prefer to sort of the face-to-face. And I think that's going to make a difference, and it's going forward as the older generations die off. That's going to be reflected as well. So I think age is very important. Gender, I think, is very important, because what we have found at Healthwatch is that most of the work we've done, I would say 2/3 of the respondents are female and 1/3 are male. So we must take care that the female voice doesn't shout out the male voice. There must be equal representation, I think. So that's a difficult one.
Okay, thank you for that very much, Dr. Underwood. We did not capture age or gender, but I would answer the question that simply says that we did actually, the majority of our responses were gathered through an online survey. And so we did have a lot of responses. So regardless of the age or gender detail, we don't have that specific information, but I think it does point out that even with people who were tech savvy enough to answer the questionnaire, we still got quite a lot of disquiet expressed. So I think that's reasonable. We did not take into account the Winter Access Fund, and what this is a snapshot of patient opinion between two specific dates, and interpretation. And we recognise that snapshot was taken at a particularly difficult time for the practices, with the Omicron variant and other issues, particularly regarding staff and staff sickness, etc. So the cloud-based telephone system, anecdotally, it seems to have improved things, but again, that is certainly not evidence-based at this point. And I thank you very much for your observation regarding terminology, receptionist, call handlers. It's always difficult to name what to do, but we will standardise that and come across with so that we actually there's less confusion. Thank you very much for your comments.
Could I just come back with very quickly, Chair, just to say you've had exactly the same problems as we've had over the last 2 years, in that we've had to consult digitally, but we must be aware that those people who are digitally excluded are being excluded from the surveys as well. So we need that should have that awareness if possible.
Yeah, we did actually try to get out in the streets and pound the streets, as it were, and stand outside various supermarkets and other points of congregation to actually try and get anecdotal evidence. We've also consulted the PPG, who will have a broader demographic than we're able to achieve. But yes, you're right. It is difficult. Thank you.
It's a problem we've all had.
Yeah. Thank you. Thank you. Can I ask Councillor Harvey?
Thank you, Chair. And it was just coming on that last point regarding the digitally excluded. Obviously, before I took up the portfolio, as others know, I was on the task and finish group, and we did actually specifically have an option available for those people where we had one member of the task and finish group who was able to telephone people directly if they so wanted. So people were aware that could happen. So there was a contingency for our digitally excluded, actually by one of our digitally excluded councillors who isn't so tech savvy. So he was specifically chosen for the role because we thought he would be best, and actually I think he did do a few phone calls that way.
Thank you very much for that. Is there anything else specifically on this paper? No. Well, in that case, thank you very much, Councillor Ainsley. We look forward to seeing your finalised report and your excuse me, on your recommendations. And with that, we move on to item 12. Now, I would like you all, please, under item 12, to also be aware of the proposed agenda items that are listed under item 14. I want to take the two together. We do have the dentistry update for the next meeting of this council. And at this point, I would like to bring in Councillor Harvey to give us the current position with regards to dentistry in Rutland. Dentistry has come up a couple of times tonight, particularly in respect of young people. So Councillor Harvey.
Thank you, Chair. Can you hear me okay? Yeah, sorry. Thank you, and apologies. I think it came up when I was offline, so apologies if I repeat anything or you might want to ask me something after. Following on from the decision by my dentist in Oakham to reduce the NHS list of 2 of their dentists, we've received correspondence from residents and councillors regarding the ability to access NHS dentistry in Rutland. Indeed, we were already aware of problems, as this had been heard in joint scrutiny in November 2021, where Councillor Waller and myself were at, which had highlighted issues. Attached to this, and this will go out with the minutes, is the link to those November papers, so that members of the public might wish to look at the report. Health Watch Rutland are currently asking residents for their experience of accessing dentistry, and a link to the survey can also be found from this. Could I ask members to share widely in their network? I think it's really important that as many residents as possible do complete the Health Watch survey. So I'll now read out a detailed response from NHS England, the Primary Care Dental League. They're the people that commission the services in Rutland. At the onset of the COVID-19 pandemic, NHS dental services were suspended in March 2020. Although face-to-face services have resumed, NHS dental practices are working in a much lower capacity as they are following social distances and hygiene rules as per the national guidelines set out by Public Health England. This is to ensure the safety of both our clinical colleagues and patient. As a result, patients may experience a delay in accessing routine NHS appointments. Practices are being asked to see all regular and non-regular patients, historically referred to as registered patients, where they can accommodate. There are limited routine appointments available, as this is dependent on the capacity of each practice following treatment of any urgent patients. This can mean that even patients who, before the pandemic, would regularly attend a practice, they're currently only able to be seen in practice if they meet the criteria for safety, accessing an urgent face-to-face appointment. If a patient is deemed not urgent, then they may wish to inquire about joining a local practice's waiting list for routine care. There is no patient registration process for dental practice. Therefore, any patient can ring any practice at any time. For assistance with locating an NHS dental provider, patients can visit, and the website is attached. Or they can contact the NHS England Customer Contact Centre on 0300 311 2233. We appreciate that some practices may be listed as not accepting new NHS patients. However, they still may be able to help by providing urgent care, self-care advice, or signposting to another relevant service if necessary. If a patient requires urgent general dental care, they are advised to call a local NHS dental practice, where the clinician will then assess if the patient requires an urgent face-to-face appointment and will endeavour to accommodate by offering the next available urgent slot. If they're unable to offer an appointment suitable to their needs, but the patient requires intervention, the patient could be referred to an urgent dental care centre, where they'll be contacted to arrange a convenient appointment. A COVID-19 assessment for the patient will also be undertaken at this time to ensure that the patient attends the appropriate clinic requiring the relevant level of protection. So it's worth reiterating the comments regarding registration for dentistry, because I think Councillor Waller will agree with me that when in joint scrutiny, we were both quite surprised that that had changed. Patients, I think, are being used to registered at their dentist. And I know when we were in joint scrutiny, a lot of the dentists are working at less than 60% capacity. So as detailed above, a patient can contact any dentist if they are experiencing problems, and they will be signposted. And for emergency cases, our closest UDC, Urgent Dental Centre, is in Melton Mowbray. So I'm afraid that gives the current situation, doesn't really help with our routine care, but does give the current thing. I know the other additional thing I was trying to do, and I couldn't find it written, and perhaps Faye can help with this actually, just putting her on the spot slightly. In my head, or maybe Councillor Waller remembers, I couldn't find it in the minutes of this meeting. I'm aware that I think that dental care is moving out of NHS, where it sits at the moment, where it's commissioned, and is actually coming through to the ICS. Now, on the back of the joint health scrutiny, as Councillor Waller will confirm, we were asking for some specific data from Rutland that was missing, because the data that was given in the report that you can see that I'll attach to this is actually only 50% of dental care. So there was some specifics missing, which meant that planning for services within the ICS were very, very difficult, because we're kind of in the dark slightly in that we haven't got so much data. So I will leave it up to the panel. I'm sorry that's not probably that helpful, but it does give the current position. And I think if we can signpost to our residents the Health Watch survey, so we can get a better survey of actually what Rutlanders are finding at the moment, but also that if you do have any residents who are having problems accessing services, it appears they can go to any dentist, and then this will all kick in. Thank you. Sorry, Councillor Waller.
Thank you very much for reading out that statement, Councillor Harvey. And I think we would all agree with you that it is what it is, but it's not satisfactory from a resident point of view. In light of that, I will be steered by you, panel, but I feel it's absolutely essential that we include dentistry on our agenda in the near future. I'm being hesitant here, partly because I think we need to make sure that when we do include it, we have the right people in the room. And if it's in the process of moving from NHS England to the ICS, at what point becomes the right point to hold those responsible accountable, which is what this body is meant to be doing. But nevertheless, I think it has to be a high priority item. Can I first of all have your agreement on that, panel members? Nod or wave your hands or something.
Totally agree, Madam Chairman.
Thank you, thank you, thank you. Fine. Dr. Underwood, do you wish to say something specifically on this?
Yes, please. It's my understanding, but it might move, that it's next year that dentistry will come under the auspices of the integrated care system. But I don't know when next year. And secondly, just to add to Councillor Harvey's comments, is the fact that what we've heard anecdotally is that the dentists locally in Rutland are possibly taking on children, but not in a position to take on adults. And we have heard isolated cases of people being told there are no NHS appointments, but they can have private appointment. And this is a no-go. They should not be told that. And we've been encouraging people that have been told that to actually complain.
I thank you. I have had emails from residents saying that they've been told that, certainly with my dentist, that the move of one or more of the dentists to private practice applies equally to children, so they can't get their children to see anybody either, which is going to help the priority of child health, dental health care in our plan. It's going to help it no end, I'm sure. Faye, do you want to come in on the timescale, please?
I'm afraid I have no further information on that either.
Okay, thank you. Well, in the pre-meeting, in the agenda setting meeting that we will be having with John Morley and his team, we'll explore timings a bit further, so we make sure that we get the dentist issue at the time that's going to be most productive, but it clearly has to happen. And as Councillor Harvey will recall, outcomes in dentistry in Rutland are not good compared with other parts of LLR. So we're starting from a low base anyway. So I think it has to be essential. The other items we've got on the next meeting is clearly Lakeside Healthcare, which is going to be a significant item. Do any of you, and the primary care task and finish group, which is an essential, do any of you have any views about what is listed as 1 and 3 under the agenda? My sense is that we get a data update, though not necessarily have it as an item for discussion, but I would appreciate any views on that, please. If there are any. William.
Well, I don't think there's any need to discuss it, but I think it's always good to have a bit of paper in front of us just to give us the updates on it. And then if we are concerned, we can ask a question.
That's a very valid point. Thank you. That's helpful, a helpful steer. Paul?
Thank you. The thought just strikes me that as this is a joint between children's and adults, it may be that we might consider somehow merging our dual interest in dentistry. It's something for discussion outside of this meeting, but I just wanted to float it.
Yes, thank you. But it isn't just to children. I mean, it is a health.
No, it isn't just children, and it's not just adults. That's my point. And I'm just thinking that maybe we can.
No, that isn't my point. My point is that this panel deals with health issues, whether it's children's health or adults' health.
Correct.
But we will discuss it outside the meeting and how best we might include our colleagues who sit on the children's scrutiny panel, because I think they will want to be included.
Thank you, Chair.
Okay. I wonder if anybody has any anything they want to raise from the council's forward plan, or anything else they want to say on the annual work plan. I'm very conscious that our next meeting is the last one of this municipal cycle. So really we were only planning up to there. Well, can I say that if there's anything else that comes up in health, or indeed adult social care agenda, and I have already mentioned to John Morley that I would like to see more on the adult social care on the agenda for next municipal year, because I feel that we've rather ignored that side of things for very valid reasons, but nevertheless we do need to encompass the adult social care side of our lives. But if anybody does have anything, if they'd like to email me, I will, and Jane, of course, as our clerk, I will make sure that that does get discussed at the next agenda setting meeting. Okay. So moving on, I haven't been advised of any other urgent business, and I have checked today and there wasn't any. And the next meeting, I keep talking about March, it's the 31st of March and 7 p.m. and unfortunately we are still via Zoom. Now that's my prejudice showing out here for everybody's benefit if you wonder why I said unfortunately. I do not think these meetings are as productive as when we met in person. I am sure that the public who are watching much prefer us meeting this way because it is so much easier. In which case, thank you very much, everybody. I close the meeting at 8:27. Good night to you all.
Thank you very much, Madam Chairman. Very efficiently run, and thank everybody else for their input. It's been a very good meeting. Thank you.
Thank you.
Thank you.
Good night, all.
Thanks,
Thank you.
night.
Thanks, Faye.
Good night.
Take care, bye.
Were you happy with that, Jane?